HbA1c glucose monitoring test may soon be changed with GA test. HbA1c test, which has been effectively used for testing the quantity of red blood cells bound, glycosylated, to sugar glucose, may have its position replaced by a newly developed test proposed by experts in Tokyo, Japan. This innovative system, invented by a team of experts in Asia, is called a GA, glycated albumin, and it will presumably be applied as an alternative for HbA1c test in detecting diabetes. Reasons why HbA1c test will likely be replaced by GA test. HbA1c test has been proven to be a precise method to measure the glucose stuck to the hemoglobin, red blood cells. This test will give information on how many % of the hemoglobin bound to, glycosylated to, the glucose. The higher the result is, the more likely the person is suffering from diabetes, so a new lifestyle or medication has to be done. Glycosylated cells will never be able to release themselves from the glucose until the cells die in around 12 weeks, and replaced by new cells which are supposed to be glucose-free, as a result of good medication or healthy lifestyle. There are reasons why HbA1c test would likely be replaced by the GA tests. Despite its good track in giving reliable results in diabetes tests, HbA1c tests also have some limitations. The flaws of this test, according to the experts, are not found in the new tests, so diabetic patients' progress can be maximized. Some of the weak points are: 1. HbA1c test takes longer time. When taking HbA1c test, patients will need more than 3 months to get the results of the test, while in GA test, the time needed to know the results of the test is only 17 days. This way, the patients will get much bigger chance to deal with his health problems and overcome them, especially those having glucose level rapid change. 2. HbA1c test is not accurate in children and elderly. While HbA1c has been giving an accurate picture of adult diabetic patients' glycosylated hemoglobin, recent studies prove that this test does not give similarly equivalent results to children. Several pediatric journals reported that some misleading information about glycosylated hemoglobin has occurred, and it has made several diagnoses on children diabetes inaccurate. The hormonal changes that still frequently happen in children have become the physician's concern, that diabetes might not be detected using HbA1c test. Similar case also happens in elderly, and even in Asian elderly, HbA1c tests can be very ineffective. 3. Situations where HbA1c is not valid. HbA1c test may not be used anymore as it also has several factors that can make it invalid. The reliability of this test has been questioned whenever the red blood cell 3-month lifespan is greatly affected by iron deficiency, anemia, blood donation and transfusion, consumption of vitamin E and C and some others. It is also proven that the test is not really effective to check and monitor patients' diabetes with failure in their kidneys. HbA1c test has been a good standard for testing diabetes, but at some point it cannot work properly due to several issues, and that's why the newly invented GA test can be a good alternative. While there haven't been accurate data on how many countries have adopted GA test as a substitute to the HbA1c, it is something relieving to know that there is an innovative test which can function better than the previous ones. More about HbA1c test in diabetes at www.curefordiabetes.co.uk.